Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. I am Bob, and I'm exactly one half of the Bob and Brad team. Today is truly an honor to be joined once again by Dr. Hamid Abbasi, a neurosurgeon. Means he's smart. And we've had him on before to talk about a minimally invasive surgery he does for the lumbar spine. But this one is a minimally invasive surgery for the sacroiliac joint. And you're going to find out that, maybe your back pain is coming from your sacroiliac. We'll discuss all that today, along with what the procedure is, where it's at, how to get it. And it'll be worth your time to watch and listen to the show. Welcome to the show, Dr. Abbasi. Thank you so much again for joining us, and we're going to talk about a new topic today. We're going to jump right in. We're talking about sacroiliac joint dysfunction. Let's talk about the treatment. Let's go into it.
Well, the first order in treating a sacroiliac joint is people like you, Bob. People who bring balance, like somebody who's using all the time just one of the sacroiliac joint. You teach them to have a good posture, to have a good balance in using that. Second order is still what you do, strengthening the muscles that protect the joint, or pelvic muscle. Many of those treatments are identical to the treatment of lumbar spine, with posture, strengthening of paraspinal and gluteal muscle, even iliopsoas, and as well some overall management of the pain expectation to reduce the inflammation. Pain medication like non-steroidal inflammatory medication like ibuprofen, aspirin, and so on. Braces has not been great to manage this. Braces, they are not really good enough braces that can stabilize that, contrary to our extremities or spine. And on top of that, some behavioral modification. Bob, I don't need to tell you. If you go and play tennis and you come back and your elbow is hurting, maybe you shouldn't play tennis for a while. So some behavioral modification is obviously important. And beyond that, please.
No, just what percentage would you say that don't require surgery? I mean,
majority of them.
Majority do not require.
Majority, like many of the patients who have after giving birth have sacroiliac joint, as you said, they go on. It may take a year and so on, but they go on and get the ligament becomes stronger and they get better. A vast majority of the people after spinal fusion may have sacroiliac problem because temporarily it has to take more, but then they as well learn and the ligament becomes stronger. They don't need a sacroiliac fusion. But still the number of the people who all the other means fail, and even the injection, you remember we talked about that many of these people, when I do therapeutic injection, say diagnostic injection, I do as well therapeutic injection at the same time by giving steroid. Many of them, they go and get better. They don't need a surgery. As well, I think there are some other, like radiofrequency ablation and some other injections that are not diagnostic that can help. Contrary to lumbar spine, those burning the nerve doesn't really work really well for sacroiliac joint.
I see.
But physical therapy, behavioral modification, and just anti-inflammatory drugs are a good first-line treatment. Second-line treatment, and less successful, significantly less successful, is any kind of bracing or radiofrequency ablation. People talk about the stem cell and this and all of that is experimental. There is no evidence that any of that really works, like taking your plasma and centrifuging it, taking your platelets or stem cell injecting there. All of that is experimental. There is no evidence that any of that really contribute. For that reason, most of insurances don't pay for that. It's cash pay. So it's expensive, and it really doesn't provide much benefit to my best knowledge at this point, based on any evidence provided.
So now we're moving on to the surgical options. And what are those?
So I think nature threw us a bone there. Now, certainly there are lots of problems with the sacroiliac joint, but it's a joint that has no function besides opening up during the pregnancy and delivery. But even that, my OBGYN colleague have told me, no, it's irrelevant. We don't really rely on that these days. If baby doesn't want to come out, you're not going to wait for sacroiliac joint to open.
Sure.
You're just going to take that baby out and we are good at it. So they're telling me it's irrelevant. Fusion of the sacroiliac joint is irrelevant, except extraordinary circumstance. And obviously, everybody in that situation need as well to consult their OBGYN doctor regarding that. But beside that, it has no function. And so the solution is easy. If too much motion stretches the ligament and cause significant horrible pain, we just have to stop that process for that joint to move too much. Unfortunately, for 70 years, the way to do that, it was a horrendous, very invasive surgery, but those times are over. We figured out finally how to stabilize the spine without causing too much surrounding damage.
So how do you do that? I mean, I know you go through the little triangle on the lumbar spine. So is there a similar spot on the sacroiliac?
Yeah, well, let's first talk about how it used to be done and why it was bad and why the new method is better. See, here you see that just the sacral and the iliac crest is connected to that, and there are tremendous amount of vessel, muscle, nerve, ligament here. To get there, you have to go through all of that. And then you get to the sacroiliac joint. It's not unusual to lose just 1/4 of your body blood just to get to that joint.
Oh, wow.
Because you have to go through all the structure. Until we figure that out, we can go to sacroiliac joint without going through the back. We just have to go from the side and go through your iliac crest and then go put literally like two pieces of wood. We have to put screws or something that stabilize that joint, that joint doesn't move anymore the wrong way. Now, initially, people start obviously putting just orthopedic screws there. The orthopedic people have been using screws for a very long time. It did work. And then some people came out with putting something that looked like a nail. Actually, as a matter of fact, they first start pins, like orthopedic surgeons start using pins before they start using screws, because it's easier to make a pin. And based on the pin technology, people start using what we call plugs, sacroiliac plugs. And those plugs are in different form. Some of them look like a nail, some of them look like a triangular kind of plugs or nail and so on. But we know that orthopedic surgeons, they have come away from pins. They mostly use screws now for a good reason, because we know the same size nail is somewhere between 4 and 7 times stronger than the same size screw. 4 to 7 times stronger than same size nail. So I started with those plugs, but I noticed that many of those patients, I have to go back and revise that. By the way, the company who made those plugs, I'm not going to say any brand names here, they finally came with the screw system themselves. They recognized themselves that screws are better. But most of the system that exists right now, they use 2 or 3 screws that they go from outside to inside. And I will send you some x-rays as well of those.
I would really appreciate that, yes.
Yeah. And those screws, what they do, they stabilize the joint. Now, the idea is that if you have only 1 screw or nail, it can rotate around it, but by putting 2 or 3, it not only makes it that it are together, but it cannot rotate around that screw, so the motion completely goes away, and hence the magic joint. These people do so much better with that. The idea of the surgery is that to stabilize, make sure the joint doesn't move and the joint grows together properly, and then the ligaments don't have to carry our entire weight anymore.
So that's 2 or 3 on one side.
On each side. And as a matter of fact, we have a new method of doing that. You know, when every time you pass from outside to inside, you have to pass through tissue. We have created a method that you pass only once, but then you put 3 screws through the same path that are connected together, that look like the Roman god of Roman god of Z, you know, Poseidon, like trident. We called it trident because it looked like a trident. But the advantage of that is you pass only once, so you put the tissue only one time passing and one time trauma, but you still get 3 screws, and it works really well. As a matter of fact, today morning I did 2 of those surgeries. Both patients went home within 1.5 hours after the surgery.
Oh,
so
amazing.
we made a surgery that used to be 5 hours, half a gallon of blood loss, to a 20-minute procedure, and patient go home same day. Almost faster than going to your dentist.
But I want to clarify, so you would do both sides at the same time?
Some surgeons do that, but Bob, I don't like to do both sides at the same time for 2 reasons. Number one is when we do that surgery, I tell my patient not to step on that joint. Makes sense. You just got a surgery on that joint. You don't want to step on that. Imagine if I do both sides, how are they going to walk?
They can't.
And if they don't walk, they may have blood clot in their leg and other problem that can be deadly.
Yeah.
There's no reason to do that. So I do one side, I let them heal so they can walk on that before I do the other side. And now here comes again the magic part of the sacroiliac joint being a magic joint. Half of the time that I fix one side, people can use it more. It's stable, bone is growing. The other side get better. I don't even have to go and do the other side because the stress of the other side goes away. So
completely makes sense.
Hence magic. So 2 reasons not to do both sides at the same time. First
How
of all,
long does the patient have to be non-weight bearing on that?
When I started this 8 years ago, I would tell the patient 4 weeks walking with a walker, not toe touch weight bearing. And I'm sure you can explain that to your audience. That means your toes can touch the ground, but you don't put weight on them. But with the new system, my patients are telling me after 2 weeks they are fine. They can, because the system is so stable, much more stable than those plugs or nail kind of instrument. And we made a study, similar size, actually sacroiliac screws are 4.3 times stronger than those plugs. So for that reason, this patient, within 2 weeks, they can put full weight on that and return to their basic activities. We generally still wait about 2 months or so we are sure we are not going to overstress, because if we do the other side, we ask them not to step on the other side.
Sure. So does insurance generally approve this?
Absolutely. Not only they approve it, now they understand. Some insurances, they want us to go and fix it after 2 injections.
Really?
Because, yeah, that's
unusual.
It is unusual, but they know that if 2 have been positive, the 3rd is going to be the positive, and then they have to pay for the surgery. They want to skip paying for the 3rd injection.
Yeah, wow.
Which makes sense, right?
Yeah, that's true. So I got to ask you the question, how many of these surgeries have you done?
I have done closer to 250 of that.
Oh my gosh.
This surgery. So I'm an expert, but I used all the knowledge I gained from treating this, not only creating a trident, a new way of making even with the screw system and plugs, it's still a 1-hour surgery. It used to be 5-hour surgery. Now they made it to 1-hour surgery. Now we made that 1-hour surgery to a 15-minute procedure by trident being so efficient of doing everything that needs to get done within 15 to 20 minutes. Now, But this is not the only thing we did. We as well, we truly streamlined the diagnostic and the treatment for this, and teaching as well, how if somebody, a fully credentialed surgeon, how can you make them efficient at that in the fastest and most efficient way? Meaning that, what it takes to make a spine surgeon absolutely expert on the sacroiliac joint in the best way possible that is good for patient.
Now, we failed to mention your website at the beginning, inspiredspine.com. And you are up in the Minnesota area, but you will take patients from outside of the state, right?
Correct. We take actually patients internationally, patients from Canada, Europe, Middle East, and even thanks to your podcast, actually a patient from Philippines called us and is coming to get treatment. So you're famous, Bob. Thank you for having me on your show.
Well, this is such a benefit to so many listeners, and we'll make sure we get the word out. We'll make sure we get the website. And, if you haven't seen already, we had 2 other previous videos with Dr. Abbasi, and we'll put the links below for those, and those are on the spinal fusions. And again, just as amazing technique, less invasive, less blood, less recovery time. So anything else you want to add, Dr. Abbasi?
Yeah, actually what I want to add is the human cost of not getting this right. This is our duty as physician, as a provider, and I see you as a provider, Bob, is to educate our patient. And as my hero and poet Maya Angelou said, do the best you can until you can do better. Then do better.
Love it.
This is on us. This is on us providers to be hungry for knowledge, to look at the data, analyze them. Yes, we deserve to go to vacation and so on, but and have a family life and so on. We deserve, as a doctors, we deserve that as well.
Yes.
But the burden on us is much higher than a random people. People entrust their loved one. They let me open their skull and spine, operate 2 millimeters from their spinal cord. They trust to come and in my operation room being completely naked, and just they trust their family, their loved one, their body to us. So we as provider, we have to do the best we can and always try to do better. But when we can do better, we have to do better. This is one of those areas that the nature has made it easy for us to make it better. So I'm truly offering everybody, even my competitors here in this town, to come. I teach you this because our patient truly deserve that.
You are truly an amazing man. I'm really inspired every time. Inspired, fine. I'm really inspired. So it was really truly an honor for you to be on our show. That. So again, the invitation is open. If there's any other procedures you come up with, we'll make sure to present those too. So, okay, again, we'll have his website down below in the comments, as well as to the links for the previous presentations on the lumbar spine. So thanks again, Dr. Abbasi.
Always my pleasure.
Yep. Take care.
Thank you. Bye-bye.